So this is the talocrural joint. So talocrural joint is formed by the lower end of the tibia, the lower end of the fibula. Okay, the lower end of the tibia included with the medial malleoli, the lower end of the fibula included by the with the lateral malleoli. Okay, so the lateral malleoli of the fibula, the lower end of the tibia, and the medial malleoli. Okay, this forms a mortise-like arrangement. Okay, mortise-like arrangement is something like this. Okay, this is this can mortise is basically the structure which is used to simulate the wrench that is used by mechanics and engineers to tighten or loosen the screws. Okay, you will see when you visit a garage, car garage or motor vehicle garage, you will see that they use various sort of wrenches to tighten and loosen the screw. So in this situation, the mortise arrangement is reminiscent to the lower end of the fibula and the tibia along with their two malleoli. It forms a structure similar to this. Why? Because the talus needs to articulate with the tibia and the fibula. So this is very, very important. Therefore the word talocrural joint is also called. Talo means the talus, crura means this mortise arrangement. Talocrural joint. So this is known as the tibiofibular mortise, which articulates with the talus. So the fibula articulates with the lateral facet of the talus. The tibial malleoli or the medial malleoli attaches with the medial facet of the talus, whereas the lower end of the talus, it is basically articulating with the superior surface of the talus, or the trochlear surface of the talus. Now we are going to see the articulation. So this joint, this is the trochlear surface or the superior surface of the talus. This is the medial surface of the talus. This is the lateral surface of the talus. So in comes the tibiofibular mortise and forms the ankle joint. So this is very, very important. So this is how it might look like if you consider talus as a single bone. Without any facets, single bone without any facets. Now this is the trochlear surface of the talus. This is how the medial malleolus forms a joint with the medial facet of the talus. Lateral malleolus forms the lateral joint with the forms the joint with the lateral facet of the talus. Now when you see this, you must understand that the anterior surface of the talus is much more wider than the posterior surface of the talus. This has a bearing in our future lectures, so we will just remember this, that the anterior surface of the talus, or the width of the anterior surface of the talus, is much more than the posterior surface of the talus. Now this is how the the talocrural joint looks like. Now for stability of the ankle or the talocrural joint, there are some things which are important. The ankle is dependent upon the superior and the inferior tibiofibular joint. So the superior tibiofibular joint, if you remember my previous classes, you will understand it is a synovial joint. It has some movement, whereas the inferior tibiofibular joint is a syndesmosis. It has very, very less movement. It's very, very strong, and it is not a synovial joint. It is syndesmosis, and it has a fibrocartilaginous disc in between the two articular surfaces, bounded by strong anteroposterior tibiofibular ligament and the interosseous ligament. Now for the tibiofibular mortise, for this structure to work out, wrench like mechanism is there in between this. So this wrench will fail if there is mobility here. So there has to be very, very good stability in this area. So this is provided by the syndesmosis. The ligaments of this area, if they fail, then the mortise will not be able to hold the talus. Like they will splay out. Especially when we are bearing weight, because of the influence of the weight of the body on this area. When the weight bearing occurs, the two malleoli has to hold. Okay, when you stand, the two malleoli has to hold under your weight bearing. If it has a ligamentous laxity in this region, it will simply splay out. Okay, and the concept of the mortise will fail. Okay, so this is very, very important. So when you think of the stability of the ankle joint, you have to think about the stability of the inferior tibiofibular joint, superior tibiofibular joint, and also we will think about the local stability in this region. For that reason, we have got some ligaments, okay, that will help to stabilize the talocrural joint. Okay, so what are the ligaments of this talocrural joint? They can be roughly divided into the medial ligaments and the lateral ligaments. First, let us see the medial ligaments. The medial ligaments, it is also called the deltoid ligament. Why deltoid? Because it is, if you see, the ligament has different bands, okay, but it goes like a fan like arrangement. If you see the Japanese fan or the Chinese fan, you will see that the upper part is splayed out, whereas the lower part is tapering and it is pinpoint. Okay, so this is a shape of a deltoid shape. Okay, so what are the this ligament is known as the deltoid ligament, and it has tibio-navicular. This is the tibio-navicular division. This is the tibiocalcaneum. That is the posterior division is the tibiocalcaneum. Calcaneum is the posterior bone. Okay, and tibio-talar. Talus is just immediately underneath the tibia, so tibio-talar. This is the three divisions. Okay, actually this is, if you see the deltoid ligament, it is actually a single ligament, but when you study its various sections, you have to dissect it, and you will find distinct three bands, but they are interconnected one another. Okay, so as such, when you look at superficially, it will look at the one single fan shaped structure, like very, very strong. It resists any force that causes over eversion. When you do over eversion, okay, then what will happen? These ligaments will become, the ligaments in the medial side will become stretched and will prevent unchecked and undue eversion. So this is one thing. And then this very, very strong ligament, this deltoid ligament, rarely injured. Okay, rarely injured. Before it gets torn or before it gets destroyed under the influence of any highly everting force, okay, there will be fracture of the lower end of the tibia. Okay, this is the medial malleoli, the lower end of the medial malleoli, rather than there will be a tear in the ligament. So strong. So that means that the pull of the force will, okay, rip out the bone rather than tearing the ligament. Okay, so such injury is known as avulsion injury. So really the deltoid ligament injuries are very rare to see. Now coming to the lateral ligaments of the this talocrural joint, we will see that there are distinct three ligaments. Okay, so this is the fibula, this is the tibia. Okay, now this is the talus. Sorry, this is the calcaneum, this is the talus. Okay, so we have got a anterior talofibular ligament, then we have a posterior talofibular ligament, and then we have a calcaneofibular ligament. Okay, so again, anteriorly position going from talus to fibula will be anterior talofibular, then from posterior part of the fibula to the talus will be posterior talofibular, and from the lower end of the fibula going straight downwards will be calcaneofibular. So in case of deltoid ligament, you will see that all the bands of this deltoid ligaments are more or less vertical. Okay, but in case of the lateral ligaments, only vertical band will be the calcaneofibular ligament, remaining both, okay, anterior talofibular ligament and the posterior talofibular ligament are horizontal. Okay, now most of you must have sustained an ankle twist or ankle sprain, or your family members or friends or neighbors or your acquaintances must have suffered ankle sprain. So when you have ankle sprain, it is mainly because of the forceful inversion. if you step on uneven surface and your foot goes into uneven area, okay, like if you stand on a stone, okay, in the uneven surface, you will see that your foot will go for hyperpronation, and sometimes it may also go for hyperpronation and hyper supination or inversion, okay. Then you will see that the anterior talofibular ligament, okay, this anterior talofibular ligament, okay, will get damaged, very commonly damaged. If the injuring force is very high, then it will pass on, okay, and it will affect the posterior talofibular ligament. Calcaneofibular ligament, it is very rarely affected, okay. So the most commonly affected is the anterior talofibular ligament. So all the lateral ligaments, okay, it will get stretched when excessive inversion occurs, okay. Excessive inversion should not occur. Now if you see, okay, we are discussing about the joint between the lower end of the tibia and the fibula and the talus, but here these ligaments are going till the navicular, it is going till the calcaneum. So here also it is similar, it is going to the, okay, calcaneofibular, that means it is going to the calcaneum, it is going to the talus. So you will see that not only the deltoid ligament and the lateral ligament stabilizes the talocrural joint, it will also stabilizes the joint between the talus and the calcaneum, or the subtalar joint, that we'll see subsequently, okay. So this is not exclusively ligamentous support for the ankle joint or the talocrural joint, but it is also the ligamentous support for the subtalar joint. Now in addition to the ligaments, we have the reinforcement by the retinaculums. Retinaculums are, tough fibrous band which are positioned horizontally, okay, and it is like prevents, okay, the bowstringing of the tendon, long tendons, and the nerves and the blood vessels. It actually holds these tendons and the blood vessels and the nerves in position. So the inferior extensor retinaculum, the peroneal retinaculum, all these retinaculum provide superadded support to the ligament, to the stability to the ankle joint.